Nursing Assistant Interview Questions and Answers.
Good morning, and thank you for coming in today for the interview for our nursing assistant position. How are you doing?
Good morning. I'm doing well, thank you. I appreciate the opportunity to be here.
Wonderful to hear. Let's start with a bit of an introduction. Could you tell me your name, a little about your background, and what inspired you to pursue a career as a nursing assistant?
Of course. My name is Gary Bosler. I recently completed my Certified Nursing Assistant CNA program at City Community College, which included both classroom learning and clinical rotations. I've always been passionate about healthcare, ever since I volunteered at a local senior center during high school. I found that I truly enjoyed helping others, and that experience really inspired me to pursue a career in patient care. The personal connections I developed and the difference I could make in someone's day cemented my decision to become a nursing assistant.
That's a very inspiring journey, Gary. Can you share more details about your training and any certifications you hold?
Certainly. I successfully completed a 12-week CNA program, which covered topics like patient safety, infection control, anatomy and physiology, and basic nursing skills. In addition, I've been certified in CPR and first aid. During my clinical rotations, I worked in various settings, including hospitals, long-term care facilities, and even a community health center, so I've gained a well-rounded perspective on patient care.
It sounds like you've had a comprehensive training experience. In your previous roles, what were some of your day-to-day responsibilities, and how did you ensure you provided quality care to patients?
In my previous positions, I was responsible for tasks such as monitoring vital signs, assisting patients with daily living activities like bathing, dressing, and eating, and ensuring they were comfortable and safe. I also assisted with repositioning patients, documenting any changes in their condition, and communicating effectively with nurses and other healthcare professionals. I always made it a point to treat every patient with dignity and respect, taking time to understand their individual needs and preferences.
That level of personalized care is crucial. Can you describe a particularly challenging situation you encountered in your previous work and how you managed it?
Absolutely. One challenging situation involved a patient with advanced dementia who was resistant to personal care. The patient would become agitated whenever I tried to assist with bathing. I realized that I needed to build trust first, so I spent extra time engaging in conversation, explaining each step gently, and allowing the patient to maintain as much independence as possible. I also coordinated with the nursing staff and the patient's family to ensure we approached the situation in a way that respected his comfort and dignity. Over time, these efforts helped reduce his anxiety, and the care process became much smoother.
That's an excellent example of empathy and persistence. In our field, managing stress is as important as providing care. What strategies do you use to stay calm and effective during high-pressure situations or busy shifts?
I believe that preparation and organization are key. I always try to start my shift by reviewing my patient's care plans and prioritizing tasks. During busy periods, I rely on clear communication with my team so that everyone is on the same page. Personally, I practice deep breathing and mindfulness techniques, which help me stay centered. I also make it a point to take short breaks when possible to recharge, ensuring that I maintain my focus and energy throughout the shift.
Those are very proactive strategies. Teamwork is vital in our work environment. Can you provide an example of a time when you collaborated with your colleagues to solve a problem?
Certainly. Once there was an incident where a patient's blood pressure suddenly dropped. I immediately observed the patient's symptoms and alerted the nurse on duty. While the nurse began preparing the necessary medications and equipment, I assisted by checking the patient's vital signs and gathering additional information from the patient's chart. We then coordinated our efforts, and the collaborative approach allowed us to stabilize the patient quickly. This incident underscored the importance of clear communication and teamwork in emergency situations.
That example perfectly illustrates how critical teamwork is in healthcare. Maintaining patient confidentiality and adhering to safety protocols is another essential aspect of this role. How do you ensure that you follow these practices?
I'm very diligent about following safety protocols. I adhere strictly to infection control procedures, such as proper hand washing, using personal protective equipment, and following the facility's guidelines for sanitation. Regarding confidentiality, I understand that patient trust is paramount. I always follow HIPAA guidelines, ensuring that any patient information is shared only with authorized personnel and that records are handled with the utmost care. I view these practices as fundamental to providing high-quality, respectful care.
That's reassuring to hear. Nursing assistant roles can be physically demanding as well. How do you take care of your physical well-being to meet the demands of the job?
I make sure to maintain a regular fitness routine that includes both strength training and stretching. This not only helps me stay physically fit, but also minimizes the risk of injury during tasks such as lifting or repositioning patients. I also practice proper body mechanics at work and ask for assistance when needed. Taking care of my health is important because it directly impacts my ability to care for others effectively.
Absolutely. It's important to lead by example. Now, let's talk about feedback. How do you handle constructive criticism and feedback from supervisors or patients?
I see feedback as an invaluable tool for personal and professional growth. When I receive constructive criticism, I listen carefully, ask clarifying questions if needed, and then implement the suggestions to improve my performance. Positive feedback motivates me to continue doing what I'm doing well, and negative feedback is an opportunity to learn and enhance my skills. In healthcare, continuous improvement is key, and I welcome any insights that can help me provide better care.
That's a very mature approach to professional development. How do you prioritize your tasks when you're responsible for multiple patients with varying needs?
I start by reviewing each patient's care plan and noting any immediate or critical needs, such as those requiring urgent medical attention. Then, I create a mental checklist to ensure I address each task systematically throughout the shift. I also communicate with my colleagues so that we can assist each other when priorities overlap. This structured approach helps me manage my time efficiently while ensuring that every patient receives the attention they need.
That's a great method. In today's healthcare environment, many facilities use electronic health records, EHR, and other digital tools. Do you have any experience with these systems?
Yes, I do. During my clinical rotations and previous roles, I regularly used electronic health records to document patient information, update care plans, and communicate with the rest of the healthcare team. I'm comfortable with technology and understand the importance of accuracy and timeliness in maintaining patient records. I'm also quick to adapt to new systems, which I believe is a valuable skill in today's fast-paced healthcare environment.
That's excellent. Continuous learning is important in healthcare. How do you stay updated on the latest best practices and any changes in patient care protocols?
I'm committed to lifelong learning. I subscribe to several healthcare newsletters and journals, attend workshops and continuing education courses, and participate in online forums where healthcare professionals share their experiences. I also appreciate any in-house training opportunities and make it a point to learn from my peers and supervisors. Staying informed ensures that I can provide the best possible care to my patients.
It's clear that you're committed to professional growth. How do you handle situations where patients or their families are dissatisfied with the care provided?
When a patient or family member expresses dissatisfaction, I take a step back and listen carefully to understand their concerns fully. I validate their feelings by acknowledging their experience and, if appropriate, apologize for any shortcomings. Then, I work with the team to address the issue, whether that means clarifying the care plan, making adjustments to meet the patient's needs, or providing additional support. I believe that clear, compassionate communication is essential to resolving these situations and rebuilding trust.
That approach shows great empathy and professionalism. Finally, why do you believe you are the best candidate for this nursing assistant position?
I believe that my formal training, hands-on experience, and genuine passion for patient care make me a strong candidate for this role. I am dedicated to ensuring the comfort and well-being of every patient, and I thrive in environments where teamwork and communication are paramount. I am also committed to continuous learning and improvement, which I believe aligns perfectly with your facility's values. Ultimately, I am eager to contribute positively to your team and help enhance the overall patient care experience.
Thank you, Gary. Your answers have been very thorough, and it's clear that you have a deep commitment to patient care and professional growth. Do you have any questions for me about the position or our facility?
Yes, thank you. Could you tell me more about the team structure here and what kinds of opportunities for professional development or further training are available?
Certainly. Our facility has a collaborative team environment where nursing assistants work closely with registered nurses, licensed practical nurses, and other healthcare professionals. We value teamwork and offer regular in-house training sessions, workshops, and opportunities for certification advancements. We also encourage staff to attend external training programs and conferences to keep up with the latest best practices.
That sounds fantastic. I appreciate an environment that values continuous learning and collaboration, and I believe I could contribute a lot while also growing professionally here.
I'm glad to hear that. Thank you again for taking the time to interview with us today, Gary. We will be reviewing all candidates and will contact you shortly regarding the next steps.
Thank you very much for the opportunity. I look forward to hearing from you soon, and I appreciate your time.
Have a great day.
You too.